I've been thinking about that recently about, AI, the impact on the other folks outside of the provider space. I think we're talking about clinical documentation. I think the impact to the client is not as direct. I think you could look at the time saved by the provider, the reduction in administrative burden, and how that impacts the provider wellness, and what that means then for the delivery of care and the quality of that therapeutic relationship. That's a little more indirect. I think more directly, this gets into other spaces we were sort of alluding to around sort of clinical decision support, but even just having quality documentation from session to session makes a big difference as a clinician. And again, you talked about scribbling notes. I was a case manager and a clinician, scribbling notes and decoding my scribbled notes and trying to understand what I did last time to this time. And I think if there is technology that can support some of that space and allow providers to feel more confident that they understand what we're doing and where we've been and where we're going, that's going to also help the client as well. I think there's a lot on the organization side too around staff well-being, around efficiencies in care, or around efficiencies in service delivery, that has an impact. So I think that there is sort of a rippling effect, if you start with the provider, but there's an impact both on the organization and especially on the client.